So first of all, I would like to speak about craniosacral rhythm. This is the third rhythm in our body. We have a cardiac pulse and breathing. Craniosacral rhythm is very important for our health, and like craniosacral therapies, we are learning or studying to explore this rhythm in our body. We can palpate craniosacral rhythm everywhere in our body, but there are some places where we will learn to palpate it more. I will show you afterwards. And we divided craniosacral rhythm in flexion and extension. It means flexion, production of cerebrospinal fluid, and extension means resorption of cerebrospinal fluid. I can show you these two phases on the skull and on the spine. I would like to introduce craniosacral rhythm on the skull, which you can see in my hands. And instead of skull, I will use a balloon, which is more flexible. So in flexion, the head is widened in transversal direction, and it's narrowing in anteroposterior direction. So it means that in flexion, the head looks like that, and it's a little bit, seems like an orange. In extension, the skull in transversal direction is narrowing, and in anteroposterior direction is widening. So the head is looking like a banana. We can also palpate a craniosacral rhythm on the dural tube. So in flexion, the whole body means spine, occipital bone, and pelvis doing this movement. And in extension is moving in this direction. So it's like rocking the baby in your hands. So flexion and extension. Also, I would like to show you a theoretical model of craniosacral rhythm. So you can see on this board this paragraph, and this means flexion, neutral zone or a break or pause, and extension. And this cycle is repeating, so afterwards the body is going into the flexion again. We can feel neutral zone or break, and is going in extension afterwards. And after each flexion and extension, we can also feel a neutral zone or break or pause of the craniosacral rhythm. When we palpate craniosacral rhythm, we, like a therapist, try to evaluate a symmetry, quality, amplitude, and rate. So amplitude means how far the body moves in flexion and in extension. Approximately it's about 3 seconds, but everybody is different, so please don't follow only this model of 3 seconds. Symmetry means how it's written here, that it's evaluation of flexion and extension in relationship to each other, or we can also evaluate flexion and extension bilaterally. It means on the left and right side of the body. We can compare them to each other. Rate means how fast is the craniosacral rhythm per minute. So one cycle is flexion and extension, and this cycle should repeat 6 or 12 times per minute. It means that you have healthy craniosacral rhythm, or your craniosacral rhythm is in balance. And the third quality means that if your craniosacral rhythm is symmetrical, you have symmetrical amplitude, and the rate is in norm, you have a quality or quality rhythm.